In this video, we're going to review two of the most common denominators found in patients who either died from or struggled with COVID. And it's not just COVID, it also exists with many other problems. So really what we want to talk about is how to reduce our risk and strengthen our immune system at the same time. Not treating a condition or disease, but how is it that we can build our immunity and also reduce our risk of different viruses, not just COVID. Hello, my name is Dr. Brandon Bupp, and if you're new to our channel, this is Leah Klein.
Hi.
And we are here to provide educational information to our community. Guys, there is not enough information out there about what you can do to become healthier and to have your best quality of life through different activities and education and things that you could do. That's what we want to try to provide for you. When we talk about immunity, it's a bit of a slippery slope for some people. This isn't like how do you treat condition A, B, or C. We're not talking about any of those things. What we are talking about is what you can do as an individual to strengthen your immune function and just be able to fight against things in a better way. So Leah, what is the number one thing that we are looking at or are discussing with our patients when it comes to immunity?
Vitamin D is super important as far as deficiency of and the people that are struggling with COVID. But we talk to our patients about stress. And vitamin D is something that's super easy to test in your blood work, and it's just not commonly done. So I think a lot of people don't realize where they're at on the scale of deficiency versus sufficient vitamin D. We don't see enough of just clear sun to absorb enough of that, to have enough in our immune system itself. And almost every cell in your body has a vitamin D receptor on it. So it's one of the most important immune vitamins, although it's more of a hormone than a vitamin.
Your body actually synthesizes it as well. But the reason why vitamin D is so important is because in order for your body to produce white blood cells, which is your army, those are your immune fighting cells that go out and fight infections, you have to have a high enough level of vitamin D in order to actually produce adequate amounts of white blood cells. And so what the research has shown is that when people have a lower white blood cell count, lower vitamin D, lower white blood cell count, they don't produce a rapid enough, impactful enough immune response. And so what happens is it kind of lingers, the infection or whatever, it lingers. And over time, it actually starts creating more and more problems, right?
Mm-hmm.
So we want a kind of a rapid and powerful immune response so our body can actually manage the infection, and having adequate levels of vitamin D make that possible. The other thing is the standard for vitamin D, if it is even tested, the standard is as low as 30. I don't know a functional medicine doctor anywhere that would recommend a level of 30 being okay.
Right? No, that's low. Our goal is like 60 to 80 range is where we'd like to see vitamin D amount in your blood work. So basically every single person, at least in Ohio, should be supplementing probably 5,000-ish units all year long. In the winter months, even more than that. So we test our patients to see where they start, where they are after a few months of supplementation, where they should be from a maintenance standpoint.
So you can not take enough vitamin D, and you can also take too much vitamin D and overdose because it is a fat-soluble vitamin. The only way to know is to test it, take in a certain recommended amount. That tells us how much a person should be taking. So if they're already close, they wouldn't need to take as much. If they're not, then if they're lower on the scale, we've seen them in the teens. If they're lower on the scale, then they would need to take more. And then we would retest that again, typically in 12 weeks, and see what kind of progress has been made. This is kind of like, maybe it's a bit of a rhetorical question, but how do we know, or we just answered it, how do we know if the vitamin D supplement is working?
We retest.
Through the blood work. People go, well, I'm taking vitamin D. And we go, well, great. Does it work? And they go, yeah, it feels better. You don't know if it's working unless you test it. The reason why we use what we use is because we know for a fact that if people take the right amounts, it will increase, right?
Yep.
So the second thing was obesity.
Obesity is one of the top risk factors for struggling with or dying from COVID as well.
right? And that is typically related to high levels of
Inflammation.
I mean, we've got like, we were on the same track with that. Yes, inflammation. When we have high levels of obesity, number one, the body does have to work much harder. And so there are ways to not be obese either. And those programs we do in our practice, it's not just weight loss to kind of starvation weight loss, it's actually weight loss to try to improve function and overall health. Again, that inherently reduces inflammation. The diet program that we use, we call it the anti-inflammatory diet, specifically because the foods that we're recommending actually help to reduce inflammation. And those things would be things like what?
Lean proteins, lots and lots of veggies. We actually don't do a ton of fruit because it does still process in your body as a sugar. Sugar is inflammatory in nature. Obviously, processed sugar is a lot worse. Little grains. We do healthy fats, lots of healthy fats. No gluten, no dairy.
The healthy fats is one of the most important ones there. Want to make sure that we're getting those, especially omegas, coconut oil, avocado oil, things like that. We want to stay away from processed fats, trans fats, unnatural, like refined fats. A lot of the vegetable oils are in that family. Those things actually create inflammation. Fast food, things that are high chemical content, highly processed foods, preservatives, foods that have high amounts of preservatives, but also like artificial flavors and artificial food colorings. All those things can be inflammatory, which impacts, if we already have inflammation and then we get into it, then we have an infection, it just makes the inflammation can get out of control at that point, right? Yeah. So what other things, Leah, can people do to improve their immune function?
So we think taking care of your nervous system is really important, and dealing with stress is really important. So we were talking before we started this video about how the relationship to immune function and stress is super important, because I think any doctor in any specialty can relate stress to inflammation to chronic disease as kind of a domino effect. I mean, that's just been researched by any kind of doctor everywhere. And so that's just a fact. So with stress, not just mental stress, but that's important too, but chemical stress, being exposed to toxins, emotional stress, I mentioned physical stress, like biomechanical stress on your body, from whether you have a joint that's arthritic or a painful joint or something that's worn down differently than other joints in your body is a physical stressor.
Chiropractic actually has been shown to improve or support a healthy immune function. Again, it's not treating a condition or disease, but when we take stress off of the nervous system, it's supporting, again, proper nerve system function, helping to get out of a state of stress, which supports immune function as well. So really cool stuff, guys. There's a lot that you can do here. We do recommend that you have a couple of these things tested. So it is possible to test inflammation. It's actually really easy to test vitamin D. A lot of times doctors don't do it because it's not covered by insurance. If it goes through insurance, it can be expensive. We do it for as little as $40 here in our office. And again, it gives you an exact number of where your vitamin D is at, how much you should be taking, but also doing a consultation on, here's where I think I'm at, here's where my overall health. Immunity really is going to reflect our overall health. The better our health is, the better our immune system is going to function. So there are ways to do that. We always offer to anybody watching this video that you can do a free consultation in our office. We do actually, even Leah does discovery calls. It's just a conversation and no obligation conversation to find out if what we do would be beneficial for somebody. Then we can move on to doing more of an evaluation, examination, certain testing, discuss what types of testing would be most beneficial for people. And so those things are all available. You can contact us through our website. You can use the phone number that's on the website. It's adv-health.com. You can also go to our Facebook page, contact us through there. You can send a message through our website as well. So all those things are available and possible ways for you to communicate with us. And again, just to find out if it would be something that we could be helpful with or not. Our next video we have coming out here real soon Make sure you subscribe to the YouTube channel if you haven't yet. We want to keep creating awesome content. The next video is really very cool. You're going to love it.